Welcome to the Nottingham Clinical Research Podcast. Our podcast brings you bite-sized updates on clinical research and related stories from the research we do at Nottingham University Hospital's NHS Trust and in our world-leading centres of excellence. I'm Harriet Anderson and I work in Research and Innovation, and it's my pleasure to introduce our latest podcast bulletin. You'll find a link in the show notes for more information on pretty much every item. So here we go.
Firstly, we're looking for people to help us with a mental illness study as long as they've never had a mental illness diagnosis. The study is to find out why some people suffer from anxiety and depression and others don't, which means comparing two groups looking at the influences of genetics and environment. You'll have to fill in a questionnaire and we'll send you a saliva kit to complete. So if you're over 16 and live in the UK and you've never experienced a mental health disorder, you can join the study by visiting the website. It's gladstudy.co.uk. That's gladstudy.co.uk. It's in the show notes as usual. Sometimes, as researchers, we want to research ourselves to find out how we're doing and what we could do better. So anyone who's participated in a clinical research study at Nottingham University Hospital's NHS Trust is offered the chance to give us their views. We use those results to improve how we design and deliver studies. The latest headline national results are just out and they're quite gratifying. 92% of participants said they felt valued by taking part in research, and 89% said they'd consider doing it again. So clearly getting involved isn't really too scary at all. If you want to find out more, the survey is called PRES. You just knew there had to be an acronym in there somewhere. It stands for Participant in Research Experience Survey, and you can find it on the NIHR website. There's a link in the show notes, or you can just Google. And congratulations to one of our researchers, gynecology consultant and Professor of Medical Oncology Srinivasan Madhusudan. He's just been appointed to NHS East Genomics as the new East Midlands Cancer Lead, and he's the latest Nottingham clinician and researcher to be appointed. Professor Madhusudan talked about some of the research he's involved in.
So what we are doing in the Ovarian Cancer Centre is really patient-focused, it's patient-centered. And we got three main aims around this. Firstly, we want to develop certain new drugs for cancer, certain new drugs for ovarian cancer. So there is a huge drug discovery program looking at what we call as synthetic lethality strategies in ovarian cancer. So that's one aspect of the research that we're doing. The second aspect of the research, and this is an important clinical question, is so many of the drugs that we use in the clinic, patients eventually develop resistance to these treatments. So we want to understand what is it that changes in the tumor that makes these tumor resistant to treatment. So to answer this question, we are prospectively following our ovarian cancer patients over the next 5 years and understand how does the tumor biology change, and that makes tumor resistant to treatment. So that's the second key strategy. And the third one is we are also bringing in some new exciting services, new treatments for patients with ovarian cancer.
It will also be investigating resistance to some therapies, including platinum-based chemotherapy and emerging precision medicines such as PARP inhibitors. And another Nottingham researcher is leading a new national research project into rare respiratory diseases. The £9.5 million LifeArc Centre for Rare Respiratory Diseases is a virtual project bringing together clinical experts, researchers and patients. Professor Simon Johnson, who'll co-lead the project, said it was a major boost for the industry. The university said the centre's experts would work together in an effort to overcome some of the barriers that can prevent new tests and treatments reaching patients. This next one isn't a specific study, it's more an opportunity for people with liver disease to meet up for mutual support and talk to researchers about what it is they're investigating, and with a chance of a short walk thrown in. We're still setting the dates, but if that's something you'd be interested in, you can email the lead researcher, Abhishek Sheth, at the Queen's Medical Centre at NUH, and the email address there is nuhtnt.nottinghamhepatology@nhs.uk. NUHTNT. I'll just do that again. NUHTNT.NottinghamHepatology@nhs.net. It will be in the show notes, of course. And a big thanks to a family helping us employ a blood cancer researcher for the last few years. The Tranter family, with supporters, walked from Lichfield to Nottingham to support the charity Cure Leukaemia, which funds a blood cancer researcher at the hospital. The walk marked 12 months since their daughter Willow was referred from Lichfield to Nottingham University Hospital's NHS Trust and diagnosed with acute lymphoblastic leukemia. She's still having regular chemotherapy here. It's part of their ongoing fundraising for Cure Leukaemia, which, as I speak, is pushing £3,000. There's more about it on their Just Giving page, which is Willow's Journey with All, and they use the same name on Instagram, and there are links in the show notes. The Baby Nottingham study, which stands for Born and Bred in Nottingham study, opened at the Trust at the end of February, involving midwives from both the hospital and the community. Professor Kate Walker, consultant obstetrician at NUH and principal investigator for Baby Nottingham, who's leading the research, explains more.
So Baby Nottingham is looking for patterns in big data sets. And the way we're getting that data is asking women who are having their baby at Nottingham University Hospital's NHS Trust to take part in the study. Any data we collect about them and their babies, just routinely as part of their care, we're asking permission to be able to use that data anonymously to answer research questions.
Baby Nottingham is just one of a national series of Baby trials who've recruited more than 32,500 women in locations including Wakefield, East London, Bradford and Doncaster. Here's Kate Walker again.
Women who take part in Baby Nottingham are going to make a massive difference to the care of pregnant women and children's health in the future in Nottingham by contributing their data, which we collect anyway. They'll be able to help answer research questions that are going to inform the care of mothers and babies in the future.
And midwives are also enthusiastic about being part of Baby Nottingham. This is Jane Oluderu, a midwife based at the QMC.
So as a midwife, I'm really passionate about improving the lives of women and their families, and I believe Baby Nottingham will really help to enhance that.
And if you'd like to help, speak to your midwife or ask at your next antenatal checkup.
Thank you for listening. We hope you found something of interest. If you did, then please subscribe, rate and review us so that more people can find out about clinical research. Goodbye from me, Harriet Anderson. And don't forget, you can find more information about our research and how you can take part on our social media channels and our website.